Welcome to the Community Living Education Project's Sharing Possibilities for Community Connections Learning event. The Community Living Education Project, also known as CLEP, is a program through Rutgers School of Public Health. CLEP is committed to providing guidance, mentoring, and education around community living resources for people with intellectual and developmental disabilities living in the state of New Jersey. The CLEP team, many who are family members themselves, can serve as a bridge for families whose loved ones may be seeking residential supports outside of the family's home. Today's webinar, the Division of Developmental Disabilities Housing Subsidy Program, is being presented by Mrs. Courtney Davey, Supervisor for DDD's Housing Subsidy Unit. To ensure the highest sound quality possible, all attendees will be muted during today's event. To interact with the host and presenter, please use your Q&A option on your screen. Topic-specific questions will be addressed as long as time allows. For consideration to all of our attendees, we encourage you to keep questions as general as possible. At this time, I would like to welcome today's presenter, Ms. Davey. Courtney, welcome.
Thank you. Good afternoon, everyone. My name is Courtney Davey, and I oversee DDD's Housing Subsidy Program. Today, I will be reviewing DDD Housing Subsidy Program eligibility, the planning process, housing options, along with the roles of various entities, including DDD, the Supportive Housing Connection, and Support Coordination. Oh, there we go. The Supportive Housing Connection is a partnership between New Jersey Department of Community Affairs and New Jersey Division of Developmental Disabilities, created to administer rental subsidies to individuals served by DDD. So the role of the Supportive Housing Connection is to process subsidy referrals approved by DDD, conduct inspections for unlicensed settings, administer housing payments, and conduct annual tenant recertifications. DDD functions include determine eligibility and policy for the program, facilitate signatures for tenants who have a legal guardian through the Bureau of Guardianship Services, also known as BGS, facilitate the collection of tenant and landlord data for admissions and internal moves in provider managed settings, conduct monthly reconciliation of tenant residential changes in provider managed settings that impact payments, determine housing subsidy eligibility for individuals in supports program and community care program seeking a self-directed setting, review move requests, determine eligibility for one-time funding, and resolve questions from residential providers, support coordination agencies, families, individuals, and stakeholders. This slide references potential housing options based on the Medicaid waiver program that individuals receiving services from. So on the left, the supports program, housing subsidy for a one-bedroom apartment. The rent must meet DDD's published rent standards. They rent directly with a third-party landlord, and they're eligible for a shared living arrangement potentially. For the community care program, they can request a housing subsidy for a one-bedroom apartment. The rent must also be within DDD's published rent standards. They rent directly with a third-party landlord or DDD residential provider. And they're eligible for a group home, supervised apartment, their own apartment, or a shared living arrangement. DDD residential providers review eligibility for community care program individuals seeking a provider managed setting. So the eligibility criteria for individuals in the supports program or the community care program who are actively seeking a housing subsidy for a self-directed unlicensed unit, they have to have active Medicaid, current NJCAT assessment, currently receiving or planning to receive DDD funded disability related services. Individuals on the community care program waiting list who have been reached in the current fiscal year initiative. Please note that DDD housing subsidies provide rental assistance only and do not provide any disability-related services and supports. Before applying for a housing subsidy, it is extremely important that individual work with their support coordinator to ensure their budget can fund the needed services in the desired living arrangement. Aside from the service budget, the planning process should also include finalizing the proposed living arrangement. A request should not be submitted to DDD if the individual is pursuing other living arrangements. The planning team should meet, discuss the services and supports the person will need ahead of submitting a request. Another consideration is who will be living in the proposed living arrangement. The names of all household members should always be included on the DDD Housing Subsidy Program Eligibility Determination form because it may impact approval. DDD has to approve any additional household members, which is why it's important for their names to be included on the request. If the individual's budget is sufficient to cover the needed services within the proposed setting. Because DDD funded housing subsidies provide rental assistance only, it is extremely important, which is why I'm saying it twice, that the support coordination agency review the individual's existing budget to ensure that it is sufficient to cover the services that the person will need in the living arrangement. For those who are receiving services through the community care program, the planning process should include a discussion as to whether the proposed setting will be provider managed or self-directed. So the provider managed is a setting owned, rented, or leased by the licensee, regardless of any underlying residency agreement with the individual served, in which the services are coordinated by a single service provider that manages all aspects of the residential services for more or one individuals in that setting. Self-directed is a setting in which the individual or the authorized representative elects to manage all aspects of the service provision by using self-directed employees, multiple Medicaid DDD approved service providers, or a combination of both. So when making a decision, the planning team will need to consider whether licensure is required. The need for personal guidance is a yes or no and should always be documented in the ISP. So the need for licensure is the following factors would inform a determination that a setting must be licensed under the provisions set forth in NJAC 1044A, standards for community residences for individuals with developmental disabilities. So the individuals in that setting are on the CCP. The setting is provider managed, which we discussed in the previous slide. The individuals residing in the setting as documented in the ISP requires personal guidance as defined in section 18.1 of the Community Care Program Manual. So personal guidance is the assistance provided to an individual with intellectual developmental disabilities on a daily basis in activities of daily living because they require help completing activities of daily living and cannot direct someone to complete such activities when physical disabilities prevent self-completion, or there is a documented health or mental health problem requiring supervision of the individual for the protection of the individual or others. In the absence of a court determination, the planning team determines the need for personal guidance for each individual in accordance with NJAC 1044A 4.3. Again, I just want to mention that personal guidance is a yes or no. So either the person requires it or they don't. Okay, so now that we've covered eligibility and planning, the next step would be submitting a request to DDD. So for support program individuals, the support coordinator initiates the process by submitting the DDD Housing Subsidy Program Eligibility Determination form for provider managed settings, which are group home supervised apartments licensed by DHS. the DDD residential providers are responsible for arranging housing payments. For someone who is moving from a provider managed setting to pursue self-direction, the support coordinator submits through iRecord verification that the planning team has met and agreed in writing that the individual guardian, if that applies, has elected to self-direct services. The planning team members are in agreement with the proposed service delivery model and have verified that the planned services can meet the individual's health and safety needs. The support coordinator submits the DDD Housing Subsidy Program Eligibility Determination form to initiate the process. But prior to submitting it, all of those things should have occurred. Requests for live-in aids are handled a bit differently. For many reasons, New Jersey Department of Community Affairs, DCA, reviews applications for individuals under services with the division requesting a live-in aid. DCA sets standards for live-in aids, and determination will be made solely by DCA. If DCA approves the live-in aid, they will administer a housing subsidy for the individual and the live-in aid, it's a 2-bedroom unit, under their state rental assistance program. The 2-bedroom unit must meet the criteria set forth by DCA, which means that their fair market housing rates would apply. If DCA does not approve a live-in aid, the individual would be referred back to DDD, and a housing subsidy may still potentially be provided minus the live-in aid. So the assigned support coordinator of the individual seeking a live-in aid may initiate the process by contacting DDD's housing subsidy unit. And this is our new help desk, ddd.housingsubsidy@dhs.nj.gov, and they can request an application. This slide is a visual representation of the submission process for supports program and community care program self-directed individuals. So the first thing that the support coordinator would do is submit the DDD Housing Subsidy Program Eligibility Determination form via iRecord. Then they email the help desk, the Housing Subsidy Help Desk, to advise that the document has been uploaded. A DDD Housing Subsidy Unit staff will respond and then make an eligibility determination within 10 business days. Generally, it's a lot quicker. Usually, I would say between 24 and 48 hours. If approved, then the individual is referred to the Supportive Housing Connection, SHC, and then the SHC issues a welcome packet to the individual, and they have 90 days to identify a rental that's within DDD's published rent standards. If somebody needs more than 90 days, if they're struggling to find a rental unit, then they could just reach out to the DDD Housing Subsidy Help Desk and request an extension. This is the DDD Housing Subsidy Program Eligibility Determination form. This document was recently streamlined. So previously, support coordinators had to submit the eligibility determination form first, and if approved, they would be given a tenant information form to complete and then submit back. This form is just one document, 2 pages, and is all that needs to be done for the submission process. So this is the first page. And so the step 1 would be planning, which is what we talked about earlier in the PowerPoint. This is page 2. Step 2 documents the proposed living arrangement to ensure that any potential household members are captured. And then step 3 is submission. Special attention to the submission instructions on the bottom, because the document is submitted via iRecord, and then after it's submitted, the support coordinator would have to email the help desk to advise that the document has been uploaded so that we know to review it. After an individual has been referred to the supportive housing connection, they're issued a welcome packet. Packet includes additional information for the tenant and some for the landlord. We revised this process about a year ago to try to make it easier for the tenants and anyone who might be assisting them, like families or support coordinators. So the first page just has the individual's name and the number of bedrooms that they were approved for, the name and contact information of the assigned SHC staff. The completed welcome packet documents listed below should be submitted to the assigned SHC staff once a unit has been identified. First form is the request for tenancy approval. It's a 2-page document that's signed by the individual or their guardian, along with the proposed landlord. And it asks for specific questions about the address, the county, and it's basically to initiate the process for a unit inspection. The DDD rental subsidy agreement, which is signed by the tenant or their legal guardian, income verification, most recent bank statements, and a copy of the birth certificate and social security card. If people don't have that readily available, that's okay. They can submit it whenever they're able to get a copy. These are key points to keep in mind after receiving a welcome packet, that the units must have a monthly rent that's at or below DDD's published rent standards. The published rent standards are also included with the welcome packet so that people will be aware of the up to the rent amounts for the county in which they're looking. Household members and additional bedrooms may not be added without DDD approval. So sometimes someone might submit a request and then a month later, you know, the planning team meets and decides that the person wants to live with their sibling or a friend. They would just need to come back to DDD and explain all of that and request a shared setting. And a special note that the SHC staff are not DDD employees. That means that they don't recognize any DDD specific language, use DDD MIS numbers, or have access to DDD applications like iRecord. So the family, the support coordination agency must use the individual's name when communicating with the SHC. It just saves everyone the trouble of going, I don't know who you're talking about. Can you send me a name? And this way you'll be able to ask your question or submit documents right away without any delays. So once a unit within the published rent standards has been identified, then the proposed landlord and the individual or legal guardian complete and sign the request for tenancy approval and submit it. The individual or their legal guardian on step 3 would submit the DDD rental subsidy agreement. Step 4, the request for tenancy approval, DDD rental subsidy agreement, and the income verification, the bank statement, and if available, the birth certificate and social security card is submitted to the assigned SHC staff. The SHC schedules the unit inspection with the proposed landlord, and then finally, the SHC conducts a unit inspection. At the time of the unit inspection, the SHC inspector gives the landlord additional documents to complete. And this is the change from before. So they give the landlord a copy of the HAP contract, W-9, and direct deposit form, when in the past that those documents were included in the welcome packet, and it could overwhelm people, which is why we changed it and had the SHC do it at the time of inspection to relieve that burden a little bit and make it easier. The one thing that I would say now, because of COVID, there's been a slight modification in the process. Some of the SHC staff are not available to work, so I have been taking more role in helping people with the documents. I've been giving them out and getting them returned. So if anyone who's listening and hears that the SHC issues welcome packets and the documents get submitted back, where they're like, hey, I just gave you documents, what are you talking about? That is the only reason why I'm presenting this in a non-COVID world. And so the changes that you might be going through now and how it's submitted are very specific to this time period and not something that is going to go on forever. So I'm presenting it as if there's no COVID going on. The only difference in what I documented in the PowerPoint versus what's going on now is that the documents are essentially submitted to me. And inspections have been suspended due to COVID. So we have an owner self-certify that the unit meets the HUD housing quality standards. So they're certifying to that in writing and signing off on it. And on slide 17, all of the 13 HQS housing quality standards are listed, and the unit must meet these standards in order to pass inspection. So after the unit passes inspection, the support coordinator or family can call the SHC and get an update. They would know after it passes that they're able to sign the lease, and then that signed lease would be submitted back to the SHC. And then the last step would be that the SHC issues the person a tenant portion letter. And that includes the subsidy portion of the rent that will be funded by DDD and paid through the SHC, and the 30% tenant portion, which is the amount the individual is responsible to pay the landlord each month. So annual recertification, approximately 90 days before the person's lease expires, participants will receive a recertification packet from the SHC. And then the individual under services would have to submit a signed DDD rental subsidy agreement, a copy of the new lease or the lease renewal, and a copy of their current income verification. And then generally a unit inspection would occur. The SHC will come out and schedule it and make sure that the unit still meets HUD's 13 quality standards. During initial prior to move-in, there's an inspection, and then of course during annual recertification, there's also an inspection. These are tenant resources that I've included on the next few slides. The first one is for utility assistance, and there's a few different programs that are listed here, and there's links for them. SNAP, and then cell phone programs, New Jersey Life through New Jersey Lifeline. And then there's also internet for Verizon and Comcast, where people who are receiving housing assistance or receive SSI can get discounted internet services, which is great. And then one-time funding from DDD. DDD has funding for security deposits and furnishings. There's a small amount available. Funding may be requested from DDD as a last resort when there are no other resources available. So the eligibility criteria for that is listed here. Because there's a limited amount of one-time funding, we ask people to request security deposit funding from the Board of Social Services first. And if they get a denial letter and Board of Social Services is not able to pay, then they can come to DDD and request security deposit funding. If they don't have the money to buy furniture themselves and doesn't have family who can help them out, and there's no community resources available in that area, then they can request one-time funding for furnishings from DDD. We do not approve one-time funding until all of the documents have been submitted to the SHC, and then the unit has passed inspection. Funding or any availability is based on the fiscal year budget appropriations too. So there might be a time when we have less money than usual. Notifying DDD of changes. DDD should be notified of changes via the housing subsidy unit mailbox if assistance is no longer needed, if they would like to move into a new unit, if they would like to add an additional household member, if they've been selected from a HUD waiting list, or begin receiving assistance from a source that's not DDD, if they move out of state or are no longer under DDD services, if they receive an eviction notice or notice to quit or a notice to cease from their landlord. Grounds for termination or denial of the DDD rental subsidy. So the rental subsidies may be denied or terminated if the tenant violates any obligation of the DDD rental subsidy agreement, commits fraud or bribery, or any corrupt or criminal act in connection with the housing subsidy agreement, engages in criminal activity, including drug or violent related activity, does not comply with providing all the required documentation, allows other people to live in the rental unit who have not been reported to the division and have received prior approval, refuses to pay their portion of the rent for damages to the unit or other amount owed by the resident under the lease to the landlord, or refuses to allow the SHC inspector and comply with HUD housing quality standards. So now we have some time for questions. Mel, there you are.
Hi, Courtney. Thank you so much. Courtney, if you're comfortable going on camera, you could feel free to click the video button on the top of your screen.
Okay, let me find that.
And you can even let me know if you need any assistance.
Got it.
Perfect. Hi. Wonderful
Hello.
information being shared. I have to say we are a little inundated with questions, so we will try to get through as many as we possibly can. And incredible questions coming in. Can you talk a little bit about if someone is on a CCP, is there an annual document that has to be completed by that individual or the guardian if they're living in a licensed setting?
Yes, there is. So for provider managed settings, a licensed setting like a group home or a supervised apartment, if it's a group home, there's generally a residency agreement that the guardian would need to sign, or the individual, along with the DDD rental subsidy agreement. We have some individuals that live in supervised apartments where they might be leasing directly with a third party landlord. So in that case, they would have that lease renewal or that actual lease with that third party landlord that would have to be submitted and signed.
Great.
Signed and submitted.
Can they reach out to your department if they need assistance with that or some additional direction? Great.
Yes.
Should they just use the email that's currently on the screen? Is that the most effective way to reach out?
Yes.
Perfect. Is there an updated fair market rate rent amounts document available? And if so, how can someone access that?
The current DDD published rent standards, they're posted on DDD's Community Living Options website. I believe it was in one of the previous slides. Let me see if I can find it and direct everybody to that one.
I have it right here.
Okay.
I am going to drop that link into the chat section right now, just for everyone's convenience. Give me just 1 second. Okay, so that's in the chat section. We actually put the live link. So hopefully that's helpful. When they go there, when they go to that portion of the website, do you know what it would be labeled under?
It would be labeled published rent standards.
Great.
And if anyone's having trouble finding it, they can email the help desk, the housing subsidy help desk, and I will email them a copy.
Wonderful. So just to let you know, we're getting multiple comments of how helpful this session has been so far.
Oh, that's great. Good.
Perfect. Can a live-in aide be a family member?
Potentially. And here's potentially. If the family member is not currently living with the person. So like if I wanted to live in aide and I wanted that live-in aide to be my sister, but I'm living with my sister right now, then she couldn't fill the role of live-in aide. But if I wanted to live in aide and I wanted my brother to do it and he's living, 2 states away, but decided to move back to New Jersey, then yes, he could potentially do that. So you can't be a current household member, but you can be a family member, just not someone who's presently living with the individual.
Perfect. Is there grant money or DDD funds available to parents that want to start their own home? So I'm going to assume that they may be referencing a group home. And I want to make sure that we point out that a licensed setting and an unlicensed settings are two very different things. But can you talk a little bit about that if you're comfortable? Are there families who are forming their own group home style residence?
I don't know if they are, and I don't know if they're doing it under the guise of a family. Sometimes there's one case in particular that I can think of where a group of 5 families got together and created their own sort of agency, but this was years ago, and they went through all of the DDD qualification process for that. As far as funding for, I'm assuming they mean capital for purchasing a home. I do not believe that there's any available at this time, but I will verify that. So for some light residential providers that are opening up licensed group homes, there might be capital available for fire suppression because that's a requirement. Other than that, I don't believe there is, but I can verify that and get back to everybody.
And would you happen to know if IDT notes count as verification that an individual's team agrees that he or she is able to live in a non-licensed setting?
Yes, the IDT notes or planning team notes generally come with signature page. So that whatever discussion that was held during the IDT meeting and the points that they went over, all of the participants and any legal guardian, if that applies, would sign off on the information that's written. So if somebody was in a licensed setting and they wanted to move to an unlicensed setting, I would get the request, and some of the questions that I would ask is about verifying their service budget is sufficient, asking them to discuss as a team personal guidance and document it in the ISP, and then planning team agreement that the person doesn't require a licensed setting. So all of those things I asked for them to be included in the IDT minutes, and then whoever is a participant or a member of the planning team signs off on them.
Courtney, I'm not sure if you would be the person within DDD that would talk about this, but if you could, can you talk a little bit about the differences between someone being in a licensed setting compared to a unlicensed setting?
So there's 3 different things I think they might be talking about. One of, like, if it's a licensed setting versus self-direction, the biggest distinguishing factor is a licensed setting, you have one service provider who is in that setting and that handles all of the services the person needs, right? In a self-directed setting, there could be multiple service providers that are providing, support for that person. There are provider managed settings that could be unlicensed as well. So the one service provider providing services and support in an unlicensed setting. So there's 3 different ways to think about it. But I think that whoever asked that question might have meant self-directed versus provider managed. And then the biggest distinguisher would be the one service provider versus having multiple.
Perfect. Let's see. Does the approved live-in aide get any rental assistance, or is the rental assistance only for the individual who qualifies or who is eligible for DDD services?
So the rental assistance covers a 2-bedroom unit for both the person under services and the live-in aide. So if Department of Community Affairs approves someone for a live-in aide, then it would just be the person under services who pays a percentage of their income towards the monthly rent. I believe it's 30%, just like DDD's program. And then the live-in aide, whoever is designated for that role, they are not required to contribute towards the rent.
We have someone who is asking, or they're sharing that their son is currently on the their son is not on the CCP, but is on the supports program. They were told that if he was not medically needy, that there would be no placement for him in a group home. Is this still true? And if it's not, who should they reach out to get clarity?
They should. I don't want to fully comment because I don't know the person's specific circumstances, but they should reach out to the DDD fee for service help desk.
Perfect. And
And
I'm sure that their support coordinator can provide additional guidance,
yes,
I would think, in that area also. And please, to everyone in attendance today, please know that quite often Courtney would have to ask 4, 5, 6 additional questions to someone's specific question. So we're trying to at least provide you with some direction to go in today. And again, you have the email address on the screen that you could always reach out to if you needed additional guidance. And you have also my email through the confirmation for today's webinar. Can parents get a rental subsidy if their child is disabled through this service?
I don't know that I fully understand the question, but I'll give a scenario that comes up often, which is someone under services could be living with their parent and request a housing subsidy. And it could potentially be approved if that parent was renting from a landlord in the community. It was a third-party rental. They could potentially get assistance, and the assistance would be for the person under services. So if it was 2 people living there, let's just say mother and her son, then mom would be responsible for half of the rent, independent from the program. And that's simply because the funding that's allocated for this program is specifically for people under services with DDD. And then we could provide rental assistance for half of the rent for the person under services. If it's just somebody who's living in their parent home, we wouldn't be able to accommodate that. Housing assistance cannot be used to rent a room or by any owner occupied unit as well.
Does documentation need to be submitted every year? Does the Supportive Housing Connection keep certain documents on file, such as birth certificate and et cetera?
They should. If somebody already submitted the documents the year before and a Supportive Housing Connection step asks for it, they can just tell them, hey, I submitted this last year, and nicely let them know that it's not needed.
Great. So I have a little bit of a longer question. It said on page 6, it indicated that the that the SCA must review the individual's existing budget to ensure it is sufficient to cover the services needed in the desired living arrangement.
Correct.
The question would be, is the rent subsidy program funded by the DDD budget, or is there a separate budget funded by the Supportive Housing Connection?
So the budget under the supports program does not include housing. The Medicaid waivers never cover housing. That's always separate. So whatever services they might need in their supports program or service budget, that's the only thing they should be looking at. Housing is completely separate through the housing, our program. That's how housing would be funded and accommodated. So they're 2 totally separate things.
Okay. So it sounds like there is someone who is currently supporting an individual with an autism diagnosis. This individual has no parents, no income, and he's trying to get back on Medicare. It seems that he may be evicted soon. How can this person help this other person with a housing subsidy?
The person doesn't have any income at all.
That's what this says, no income.
That could become a little problematic. We do ask that the person have income, not to pay for rent, but to pay for all of the non-rent costs in it, living in an apartment or a rental, like utilities and food, phone and things like that. So if somebody doesn't have income, the concern would be, how would that living arrangement be sustainable long-term? So we would ask that they work on identifying and establishing a permanent source of income, and then come back to request a housing subsidy for us. It would be different if somebody was receiving housing assistance and let's say they lost I had a case recently come up a few months ago where someone was just competitively employed. He lost his job, and he had money covered, and he was able to get assistance for utilities and food and get assistance from his parents, and we covered his full rent until he got a job a couple of months later. If somebody doesn't have the ability to cover non-rent costs, it becomes problematic, and it won't be approved until their permanent source of income has been established. And that's just really simply to make sure that the living arrangement is going to be viable long-term. It's the only reason. We don't want to set anybody up for failure, basically.
And if they reached out again to your department, would they be able to get additional resources or information specific to their case?
Yeah, I can help them. They should reach out to the help desk.
Okay. So we have someone else asking, is supportive housing available if individuals to choose to live with a family member in an apartment, for example? I think that you covered a few different scenarios already, specifically, right? If a loved one's family member lived outside of that home and we're going to be considered a live-in aide. Can you expand on the responsibilities of a live-in aide, or who may be eligible to qualify to have a live-in aide?
Sure. So I have a 2-page document that explains like the eligibility process for live-in aides, and I can send that out to anyone who might be interested. The thing that I would stress is anyone requesting a live-in aide, it would be somebody that needs assistance on the overnights. It could be safety, not knowing what to do in an emergency, or it could be medical care, medication needs. So that having that need, and then having the service budget to support that need, because there are certain forms that would need to be filled out by a doctor that document the number of hours per day that person needs staffing and support. And so if it said 7 a.m. to 7 p.m., then they're Monday through, Sunday through Saturday, 7 days a week, then they would need a service budget to support 12 hours of staffing each day. So the service budget and their needs being significant during the overnight hours would be things that someone who had those two things should apply for a live-in aide, or could apply for a live-in aide. As far as like what that person might do, the live-in aide might do, what their responsibilities might be, that's up for the planning team to determine. Any compensation, financial compensation for them would be discussed by the planning team and agreed upon. DCA would not get involved in that. Or their household tasks, like do they have to clean the bathroom and the kitchen, or whatever they might be responsible for. It's really up for the planning team to decide.
If an eligible person is approved for rental subsidy, does it matter who owns the rental unit? Could it possibly be owned by the special needs trust?
The special needs trust would have to be reviewed first. So if somebody had a unit owned by a special needs trust, it would have to be reviewed for us to look at who the beneficiary of the trust might be.
And again, a lot of these are really specific questions. I'm sort of just going to throw them out in case there are a general answer or another resource for someone. How much in advance does the supportive housing connection want to receive signed off RA and RSA? I'm not sure what that is.
RA, residency agreement, rental subsidy agreement.
Okay, thank you.
Earlier, the better. They love getting things earlier. So I mentioned before, they send out the recertification packet at least 90 days before the person's annual, before their lease is up. Sometimes it's 120. So if the residential provider or whoever's helping them wants to get it back right away, that's fantastic. We have close to 9,000 tenants with DDDs. So there's thousands of renewals to do and complete each month. The SHC has to do that. So the earlier, the better. That gives them more time. And then that means that the person gets their new tenant portion letter sooner. And people generally feel good about having it sooner, so they know the amount to pay each month. It's just better for everybody across the board.
And someone's just looking for clarity. They want to just confirm that during the pandemic, that the process is still to submit the eligibility form directly to you.
Yes, you can, if somebody submitted the housing eligibility determination form to me, that's fine. The new form that we just launched, it's submission to the DDD Housing Subsidy Unit Help Desk. But it's not that I wouldn't reject somebody for sending it to me. That would be fine. The change with the pandemic was really me collecting all of the documents that the tenant might need, their income, their rental subsidy agreement, and then the landlord forms. And that was simply to avoid any delays. Anyone looking for an apartment during the past year can attest to the fact that some rentals in certain counties are in short supply. And so you have to get on it right away if there's an opening. And people would just email me and give me the forms. I could approve it right away. On rare occasion, potentially deny it. And then everything just moved a lot smoother. I didn't have to worry that, it might have been submitted to an SHC staff that might have gone out 2 weeks because of COVID. And then there's like a delay and people lose apartments. So just to avoid any delays and people missing out on opportunities like for apartments, I was doing most of the referrals and collecting the documents. That will change once the COVID restrictions have fully lifted.
Okay. And who should someone contact if they haven't received the consumer recertification documents?
Contact the Housing Subsidy Unit Help Desk, and I can make sure that one's sent out. I can contact the SHC supervisor and make sure that one's gone out.
Okay, says, can you comment about the process for a client, for an individual moving to New Jersey from a different state? Is there a wait time? Is there a specific process to bridge the gap as someone's coming from out of state?
The first step for anybody out of state is to do an intake application with DDD. And it's posted on a website. I can email you the website where the intake application is posted. The DDD intake unit is great, and they generally, once they get a full application, can move things along rather quickly. And then as soon as they are approved for services and they select a waiver, let's say it's a supports program, and they get a support coordinator, they can submit a housing application right away.
So can you talk about the opposite of that? If someone is going from New Jersey and they are currently receiving a rental subsidy and are moving out of state, who should that individual or guardian contact in the new state to see if that support would still be available?
I think that would depend on the state the person's moving into. Certain states have better services than others. I would strongly encourage them to research available resources in the state they intend to move to prior to moving, so they know what the expectations are. In some states, there could be a lengthy waiting list for housing assistance. And so if they were to move, let's say to Florida, and there was a waiting list, then what would be the plan once they arrive there? There would be, a lapse in services and support. So definitely plan ahead and look at the resources that they might be offering. I think personally, although I'm biased, our program is probably one of the best in the country. We have availability and we can get things done right away.
And is residency a prerequisite for someone to complete that application who is moving to New Jersey?
I believe it is, yes. I will double check that because intake is not my area of expertise, but I believe so. They have to be a New Jersey resident.
Okay, perfect. So to the individual who was asking that question, please reach out to the email on your screen for clarity. And how often are the rentals, the fair market rates updated?
We generally, DDD adopts our published rent standards. That's what we call them. We adopt them from Department of Community Affairs, DCA. So in most cases, the published rent standards are adopted annually. This past year in 2020, DCA did not revise their fair market rent amounts. So we did not revise our fair market rent amounts. I think that ours are competitive, especially in the small area counties. There are certain counties in Bergen, Passaic, Monmouth, Ocean County, and then Camden, Burlington, Gloucester, and Salem, where we use the amounts based on the zip code. So it accounts for variations in certain parts of a county. So in Bergen County, Ridgewood is different rent than Hackensack, and use of zip codes would reflect that. You know, it's easier for people to find rentals if they're basing it on zip code. So the counties in which we use the small area amounts are the exact same counties that HUD uses the small area amounts for. Those are the counties they're mandated to use them for. DDD certainly didn't have to do it, but we wanted to give more people opportunities. So we started using small area amounts in 2018. And I have to say, especially for Bergen County, in Ocean County, Monmouth County, and even Burlington, it has been a great success. Very rarely do I hear about any difficulty in those counties. So in most cases, it's a year. This year, perhaps because of COVID, DCA didn't update theirs. There should be an update next year, but I guess we'll wait and see. And it's generally updated at the end of the year between October and January.
Wonderful. So when we talk about the fair market rate, sometimes we have families that CLEP is supporting who will exploring all options, right? That's what this is about. It's not a one size fits all, and that's why the state's offering different levels of support, service, and options, and that's why you're sharing the information that you're sharing today. Can you talk about with the fair market rates, we often have families who say, well, I will then contribute so that they can go over in that fair market rate. Can you talk about the limitations surrounding that, and in regards to if that's allowed or not?
We do not allow anyone whose family member might be generous enough to be able to pay the difference between the actual rent. So let's say the published rent stays, but the actual rent is I don't know, $1,100, and someone's parent wants to pay the $100 difference each month in order to get them into an apartment. That's not something we allow. There's a couple of reasons for that. That money from a family member counts as income and could potentially jeopardize that person's Social Security benefits. That family member's income could change without notice, and there might be a time where they can't afford to pay that. And then what happens if they're no longer if something occurs in their life and they're no longer to put out the extra $100 a month? So that leaves the person in, a situation where they would owe money to the landlord and potentially get evicted. And the other reason is we apply the must be within the published rent standards rule to every participant, and it would just erode integrity of the program if one person was allowed to exceed it and another person wasn't. So the standard is that everybody has to rent within the published rent standards.
And in regards to finding housing within those standards, within those fair market rates, where can families go? Where can individuals go to identify locations within each county or town?
There's the Housing Resource Center. That is a website that lists properties. New Jersey Housing Resource Center. I know that people have had success with hotpads.com. They list rentals there, and you can search based on county or based on a maximum rent amount. Apartments.com is another one. Anyone who's struggling, they can also reach out to the help desk, and I'll help them search. We'll look for things and see if we can find. Generally, anyone who might be struggling, it's due to a narrow geographical preference. So I'll talk to them about maybe expanding that, maybe not just one county that you want to, or one town in a particular county. Maybe we could look in the whole county versus just a town, or perhaps another county to help get them into something that they might like.
So I do want to remind everyone for the questions, please only use the Q&A section. We do have a lot of questions coming into the chat. Let's see. So is there a waiting list for housing for your
No,
department?
no waiting list.
Okay, great. When people are referencing the waiting list, again, that's something that people really should be reaching out to their support coordinator and finding out more details. But specifically for Courtney's program, there is not a waiting list currently.
No, we've never had a waiting list. Last year, at the height of COVID, we suspended non-emergent referrals just because COVID was so bad during that time. I think it was from late March through early September 2020. But since September 4th, 2020, we've been opening up to everybody, emergent, non-emergent. So it's never been a waiting list.
Okay. I know we're talking a lot about apartments. Does this also apply for homes, for houses that are accepting rent? Or
yes.
is this for apartments?
It doesn't, the rental is a rental, so it doesn't necessarily have to be an apartment. It could be a single family home. Like if someone was approved, it might be difficult to find a 1-bedroom single family home, but if someone was approved for a 2-bedroom or perhaps a 3-bedroom and they identified a rental that was a 3-bedroom single family home, that's fine too. A rental could mean any of those things.
What happens at renewal if someone's rent increases more than the PRS does?
So in that case, if they rented the first year and it was right at the published rent standards, and then next year the landlord raised the rent by 3 or 4%, then the rent increase would be covered by the housing assistance. The person would still just contribute 30% of their income towards the rent.
Again, we have someone asking about people who need housing but have no SSI or SSDI and very limited income. Again, we're going to share to please reach out. I think there's going to have to be a lot more questions asked in order to provide some very specific guidance to those situations. If a person gets funding for security deposit and moves to another apartment, let's say within a year, what happens to the security deposit? And does moving mean having to come up with another security deposit themselves?
Potentially. And the only reason I say that is because, so if DDD funded a security deposit and then the next year at renewal, the person wants to move, that's fine. And it would also be fine for them to take that security deposit with them to the new location. The problem is a timing issue, because most times the current landlord won't return the security deposit until after the person physically moves from the apartment and they've had the opportunity to inspect it for damages. The new landlord will want the security deposit prior to move-in, and so timing issue. We only give security deposits one time. So if they weren't able to work out that timing issue by either getting the landlord to give them the security deposit back early, then they would have to come up with the security deposit for the new landlord in that new apartment, or perhaps ask another community resource for assistance with the security deposit.
And can multiple people live in the same environment if they all are receiving rental subsidy?
Yes, absolutely. If that's their choice. Yes, of course. We have many living arrangements where people both under services, they might be living with someone who's not under services. Certainly they may do that. And if it's a shared living arrangement, the rent is always split equally, and everybody, sorry.
Don't be sorry.
My alarm, sorry. Then the rent will be split equally amongst everybody. So if the rent is 1,000 and there's 2 people, each person would be responsible for 500, and then they would contribute 30% of their income towards 500. Other housing assistance programs, they look at the total household income and then base a portion on the combined income we separate it out so that everybody is paying 30% of their income and everybody has a housing subsidy. So if one of the people, you know, wasn't working out after 2 years and they wanted to move, they could take their housing assistance and move to another rental unit.
What happens if someone's income changes over time?
They should contact the help desk, housing subsidy help desk, and I can make sure that their tenant portion is adjusted. The sooner they let me know, or they can contact the SHC as well. But the sooner they let us know, the sooner it can be adjusted, and I can make sure that it's done right away, especially if it's an income loss. I don't want anyone to struggle to make their tenant portion, or perhaps not say anything, and then, you know, it lends itself to falling into arrears with the rent, and we don't want that to happen. So let us know as soon as possible, and we can have that 30% tenant portion adjusted right away.
So I see that we're at time. I want to get to one more question if we can.
Sure.
I apologize to everyone. I have to say we have over 80 questions right now. So obviously very hot topic. So just so everyone knows, we will be sharing these questions with Courtney's team and the rest of DDD, just so that they're aware of the needs of the community. And who knows, maybe we'll even see if there's another follow-up session that might be useful to address some of these other concerns or questions that have been identified. So the last question is, where can one access the new DDD housing subsidy form? If someone has recently submitted an old form through their support coordinator and hasn't heard back from DDD in over a month, what can someone do?
If they submitted it the old way and they haven't heard back, they should definitely reach out. There could be an issue that the email got dropped and I didn't get it. It had an attachment for whatever reason. So they should reach out to me on my email, or of course contact the help desk, and I can get them an answer right away. That is way too long. And I said earlier, I like to get back to people within 24, 48 hours, assuming I'm not on vacation or something, so that people don't have to wait and that they have an answer right away. So anything outside of that something happens where I didn't get it.
And we want to make sure also, right, there was a portion of time where it was only emergency cases
Right.
due to COVID.
Right.
So I'm not sure of the time frame, but I think that's, you know, it's definitely worth having follow-up, and they can just submit that. Any questions, again, to the email address, is that correct?
Yes, that's correct.
Perfect. Or again, have your support coordinator to specifically reach out. So Courtney, thank you so much. Again,
You're welcome.
There was incredible interest in this session, much needed information being shared. So we cannot thank you enough from the club team to your team. Thank you again for taking the time to really, you know, work with us and being so willing to participate in this series. So thank you again.
Oh, you're welcome.
And for everyone in attendance, you're going to see a really brief survey pop up after we sign off today. And so it should be on your screen. It might take 30 seconds. Please complete that. It's information that you provide to CLEP that allows us to really focus future sessions based on the needs of the community. If there are any other questions that you have, feel free to submit them to my email, or even to the DDD housing subsidy email on your screen for a direct response. And don't forget to use your support coordinators as a resource also for additional information. We hope to see you next Tuesday for the final part in this 4-part DDD series. And then the following week, we will have a presentation with the New Jersey Council for Developmental Disabilities. Thank you again, everyone, for joining us. The recording will be sent out within the week, and we look forward to seeing you next Tuesday. Courtney, please have a wonderful day.
Thank you. Bye, everybody.
Thanks. Be well.